Welcome back, brilliant humans, to the show that keeps finding new and increasingly elegant ways to explain why doing more is often the exact wrong answer. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who has spent 20 years watching people escalate their way into the very problem they were trying to solve and has feelings about it. Dr. Lazuk is not with us today because she is currently somewhere in the highlands of Patagonia, having accepted what a colleague described as a casual research retreat that has since evolved into a full expedition involving a glaciologist, two climate scientists, a llama named Bernardo, and an impromptu lecture series on cellular aging that Dr. Lazuk apparently began delivering to the research team on day 2. After all, the evenings were long and the science was relevant. The glaciologist has reportedly taken 12 pages of notes. Bernardo has no opinion. We await further dispatches. So, you have the avatar, and today we are having what might be the most important conversation in this entire series: why anti-aging fails. Not why individual products fail, not why one specific treatment stopped working. Why the entire approach, the dominant model that has governed how we think about skin aging for decades, quietly breaks down for enormous numbers of people who are doing everything correctly. And here is the answer in one sentence before we go anywhere else. Anti-aging fails not because the tools are weak. It fails because the system was never prepared to respond to them. Read that again, because everything else in today's episode flows from that one idea. Here is what this looks like in real life. You have a consistent routine, good ingredients, reputable treatments. You are not cutting corners, you are not being careless, and yet results plateau. Progress becomes unpredictable. Skin starts reacting instead of recovering. More effort produces less return. Things that worked beautifully at some point stop working entirely. And the conclusion is obvious. I need to escalate. Stronger actives, more frequent treatments, newer technology. If it is not working, push harder. Except, biology does not interpret intensity as commitment. It interprets intensity as demand. And when demand consistently exceeds a system's capacity to resolve stress, the system does not improve. It adapts defensively. Repair slows. Sensitivity increases. Inflammation lingers. Tissue becomes reactive rather than resilient. You have not been pushing hard enough. You have been pushing past the point where pushing helps, and those are not the same problem. They require opposite solutions. Here is what is actually happening underneath all of this. Think back to what we covered in our last few episodes about how aging works at the biological level. Cells need 3 things to function well and repair effectively: clear instruction, intact communication between cells, and a supportive environment that allows signals to land and resolve correctly. Remove any one of those 3 things and even the most advanced intervention struggles. Remove all 3 simultaneously, which is what chronic overtreatment combined with low-grade inflammation and barrier dysfunction does, and you have a system that is essentially trying to receive radio signals in the middle of a thunderstorm. The signal is there. The equipment is there. The static is winning. Now, here is the part that trips people up. The inflammatory sabotage Dr. Lazuk is describing is usually not dramatic. It is not obvious redness or acute irritation. It is low-grade, unresolved inflammatory signaling that never fully shuts off. The skin sits in a permanent defensive posture, prioritizing barrier repair and immune vigilance over everything else. And no amount of collagen stimulation overrides that biological priority. The body is not being difficult. The body is doing exactly what it is designed to do when it perceives an ongoing threat. It protects rather than regenerates. Oxidative stress compounds this. Energy production becomes less efficient. Mitochondria, the power generators of your cells, start underperforming. Repair pathways that depend on adequate energy activate sluggishly or incompletely. Signals arrive distorted or too late to be useful. The system is not broken, it is exhausted. An exhausted system that you keep demanding more from does not catch up, it falls further behind. This also explains something that confuses people enormously. Why can two people use the same product or receive the same treatment and have completely different results? One person's system resolves the intervention efficiently and adapts positively. The other person's system accumulates strain and reacts defensively. The difference is not the intervention, it is the state of the system receiving it. Same input, completely different biological readiness, completely different outcome. So, what does this mean practically? What do you actually do with this information? You stop asking what to escalate to. You start asking whether your system is in a state to respond to anything at all right now. And that means, in this order, quieting inflammation before stimulating repair, supporting barrier integrity before accelerating turnover, improving signal clarity before increasing demand, creating the conditions for regeneration before introducing the things that ask regeneration to happen. This is what Dr. Lazuk means when she talks about readiness. It is not passive, it is not giving up on results. It is understood that the most powerful thing you can do for your skin right now might be to reduce what you're asking of it rather than increase it. Here is something that surprises almost everyone. Simplifying a routine, removing irritants, reducing actives, restoring barrier integrity, does not make skin passive. It makes skin available, available to receive signals correctly, available to communicate between layers of tissue, available to complete repair cycles that have been interrupting themselves for months or years. Anti-aging starts working again, not because the strategy changed, because the system finally could respond to it. And this is where AI-driven skin analysis becomes genuinely useful rather than just technically impressive. Because the critical clinical decision, the one that determines whether everything else works, is not which treatment to use or which ingredient to add. It is assessing the current state of the system. Where is inflammation persisting beneath the surface? Where is the barrier function compromised despite apparent hydration? Where is recovery capacity limited, even when turnover appears active? Human attention gravitates toward visible symptoms. AI reveals patterned imbalance across systems, and that difference in perspective changes the entire order of operations. Instead of escalating based on what you can see, intervention becomes conditional based on what the system can actually process right now. When inflammation is elevated, calm first. When barrier integrity is compromised, support before stimulation. When recovery signals are weak, slow down rather than intensify. This is not conservatism, it is systems intelligence. It is the difference between throwing resources at a problem and actually solving it. When anti-aging works correctly, when it is timed right, sequenced right, and introduced into a system that is ready to receive it, it does not feel aggressive. It feels stabilizing. Skin becomes less reactive. Recovery improves. Treatments last longer. Results compound instead of resetting every few months. Progress becomes predictable rather than volatile. And that predictability, that quiet, consistent, undramatic improvement, is what Dr. Lazuk has been building toward with everything. The formulations are designed to reduce noise rather than add to it. The treatment protocols sequenced with recovery are treated as a biological requirement rather than an inconvenience between interventions. The AI analysis was built to see what is easy to miss when you are focused on individual symptoms. Not louder, not stronger, not more frequent. Aligned. When instruction is clear, communication is intact, and the environment is supportive, skin does not need to be forced into improvement. It responds calmly, predictably, and with far less resistance than you have probably been experiencing. That is what modern anti-aging actually looks like when it works. And now you know why yours might not have been working. And more importantly, you know exactly what to do about it. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice, clinical guidance, or a treatment protocol of any kind. Anti-aging science is complex, individual, and best navigated with a licensed professional who can assess your specific system in its current state. Please consult a qualified dermatologist for personalized guidance. Dr. Lazuk will be available for consultations as soon as Bernardo the llama agrees to escort her back down from the highlands. Negotiations are apparently ongoing. May your skin always glow as brightly as your smile.